Patty, I know that constipation can be a challenging component of being treated with chemotherapy. Could you tell us more about that?
Constipation is something that is very important to try to avoid. Patients should let their healthcare provider know if they have an existing problem with constipation and what they do to help manage that now. Going without a bowel movement for 24 hours is something that needs to be addressed pretty quickly, and there are medications that can be obtained over the counter, and you can discuss that with your nurse to get specific indications as to what you might use. Missing a bowel movement on that second day really needs to be reported so that the nurse can advise you as to what you need to do to prevent any kind of long-term problems. Nutrition, adding fiber to your diet, exercise really helps to increase keep you regular on a daily basis. And also if you're taking pain medications, those can certainly slow your bowels down and cause you to have some problems, and you may already know that from past experiences. So being well hydrated and also letting your nurse know if there's any problems with constipation is very, very important.
So early intervention, early reporting of those problems sounds like is a critical component of what patients need to do.
It's a very important component. You can spend quite a bit of time, and it's very uncomfortable if you have to deal with a problem that goes on for several days. So the earlier that we can help you manage that problem, the less problems you're going to have long term.
And some patients with their chemotherapy may have lowered white counts, so if they get enemas or things over the counter, they should let us know before they administer those because of a potential increase in infectious risk.
I discourage any enemas or any kind of rectal suppositories unless you do check with your nurse. She may want to check your blood counts to make sure that your counts are adequate before we even advise that kind of an intervention. So keeping them posted is very, very important.
Yes.